Do libido pills live up to their claims? Plus, how to rekindle the passion after pregnancy? Everything you wanted to ask about sex, but didn't. Now you can ask Dr. Leah, sexual health expert and associate professor in the Department of Health and Human Performance. Here she is, Dr. Leah.
Thanks, Derek. It's great to be here today with all of you. I'm Dr. Leah Janine. We're here to answer your questions about sex and relationships. We have a lot of the latest research and a little common sense. Plus, we have a special guest here to reveal how cannabis can improve sexual experiences. But first, let's take on some viewer questions.
Okay, Dr. Leah, here's our first question. A man says, I've recently been having pleasureless orgasms. Sometimes it feels great, and other times nothing. What's wrong?
There are painful or incomplete orgasms, and some that may occur during a pressure-filled encounter.
But if your pressure-filled encounter, you're stressed, you're probably not going to have an orgasm. So what would be the other reasons for having a bad orgasm?
Well, one is not feeling okay while you're having sex. Okay. Face it, it's pretty tricky for an orgasm to be good when the entire encounter is not so good. It's also hard to have an orgasm when you realize midway through that you can't stand the person you're having sex with. Or maybe you're just too tired to have sex, but you did it anyway.
Okay, that's fair enough. Are there other reasons?
Well, it can also happen when you're having sex to avoid conflict, which researchers call conflict avoidance. This may happen if someone feels like their partner really wants sex and they want to avoid a fight, which may occur if they say no. Another reason you could have a bad orgasm is if you feel pressured to orgasm, known as the orgasm obligation. This can make people feel like they absolutely must orgasm or else the sex will be seen as a failure. The fourth scenario is that orgasm negatively impacts your life. This often occurs when you're watching porn that your partner dislikes or even porn that you're ashamed of watching.
Let's go to the second question. A woman says, my new boyfriend doesn't like wearing condoms and I am past the age of getting pregnant. Should I be concerned about it?
Well, obvious answer here is yes. You need to be concerned about contracting a sexual infection or disease. A latex condom will prevent sexually transmitted diseases, including HIV, the virus that causes AIDS, and consistent and correct use of latex condoms reduces the risk of sexually transmitted diseases, or STDs, that are transmitted through genital secretions and, to a lesser degree, genital ulcers.
So are condoms 100% guaranteed to keep STDs away?
Condoms provide different levels of protection for various STDs. They work by preventing contact between the condom wearer's penis and sex partner's skin, mucosa, or other genital secretions. Condoms offer a greater level of protection against diseases transmitted by genital secretions. A lesser degree of protection is provided for genital ulcer diseases or the human papillomavirus, also known as HPV, because these infections may also be transmitted by exposure to areas like the infected skin that are not actually protected or covered by that condom.
So if a woman who is past the age of getting pregnant is living with a man and both are not dating anyone else, is there a need for a condom?
Well, assuming everybody gets tested for everything, then technically there wouldn't. But men can actually not get tested for HPV.
Okay, why can't men get tested for HPV?
Well, actually, let me correct it. There is a test, but it is not FDA approved because it's really difficult to get a good cell sample to test from the thick skin of the penis.
Okay. Let's go to our next question, Dr. Leah. A friend told me the best way to prevent ED, erectile dysfunction, when I get older is to masturbate. Is my friend joking around, or should I take him seriously, or do teenager boys know something that we don't know about?
There was actually a study. European scientists caused quite a stir when they published the results of a study which showed that infrequent sex can lead to erectile dysfunction. The study, published in the American Journal of Medicine, tracked 989 men in their 50s, 60s, and 70s for 5 years. It showed that the men who reported having sexual intercourse less than once a week were twice as likely to develop ED.
All right, so what does that mean in terms of masturbation and its effects?
Well, that's the thing. The study didn't address the question of whether masturbation helps preserve male sexual function, but it may help, or at least that's what one of the authors concluded. The study also says that it's premature to conclude that frequent sex or masturbation can help prevent ED. Having sex and masturbating both have benefits, but I can't say conclusively that it would prevent ED.
Can infrequent sex or being celibate cause ED?
Well, urologists say that while infrequent sex is clearly associated with ED, it's unclear that it causes ED. There's a clear chicken and the egg problem here because people who are having ED might be less likely to have sex. But given the many benefits of sexual activity and the possibility that the study is correct about sex helping to prevent ED, there's a reason for everyone to stay in the game.
So men, keep going forward. Keep doing what you're doing, man.
Absolutely. Have fun. When in doubt, go for it.
There you go.
Still to come on Sex Talk. Intimacy after pregnancy. Cannabis and sex. STIs on the rise.
During pregnancy, there are a lot of physical and emotional changes that can get in the way of being intimate. Here are some tips that can help.
Adjusting to the demands of parenthood, physical changes, and exhaustion can create challenges for couples seeking to reconnect emotionally and sexually. However, with understanding, communication, and a bit of creativity, it's entirely possible to nurture and revive intimacy after pregnancy. Amidst the busyness of parenting, carving out quality time for each other is essential. Even if it's just a few minutes each day, dedicate that time solely to each other. Engage in activities you both enjoy, such as going for walks, sharing a meal, or watching a movie together. Fostering emotional connection outside of the bedroom helps strengthen intimacy inside it. Non-sexual physical touch and affection play a crucial role in rebuilding intimacy. Hugging, cuddling, holding hands, and gentle kisses can help rekindle the emotional and physical bond between partners. Small gestures of affection throughout the day can make a significant difference in fostering closeness. Be gradual. Resuming sexual intimacy post-pregnancy is a personal journey that varies for each couple. It's important not to rush this process and to listen to your body. Seek guidance from your healthcare provider on when it's safe to resume sexual activity after childbirth. Experiment with different forms of intimacy, such as sensual massages or intimate conversations, before gradually reintroducing sexual activity.
Be patient and take care of yourself. When you prioritize wellness, you have more to give to your relationship. Coming up, are smart sex toys better than regular sex toys? And we will break down the promise of Libido vitamins and whether or not they really work. That's next.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about Sex Talk. Go to askdrleah.com.
Welcome back to Sex Talk. Today we have a colleague of mine, the Chief Innovation Officer of NTM AI and author of Transforming Orgasms with Psychedelics, Cannabis, and Science. Nathaniel Morris, thank you so much for joining us.
Thanks for having me.
So tell us about how you got into this research. Why cannabis and psychedelics?
It's a great question. So actually, I was originally studying rare cannabinoids and how they impacted epilepsy. I was one of the original people that was developing CBD treatments for pediatric epilepsy. And then there was a breakthrough study that came out revealing that the experience of rhythmic entrainment leading to orgasm is actually on a neurological level almost identical to the experience of rhythmic entrainment leading to sexual trance and also epilepsy. And so the fact that those two parallels happened, and I was in the process of studying how CBD affected epilepsy, I realized I could switch gears and start studying how CBD was affecting sexual trance. And it's a much easier subject to study, and the health implications around epilepsy are quite serious, whereas sex is much more lighthearted. And it led to a whole bunch of really exciting discoveries around what cannabis can and can't do in a sexual context.
So how does cannabis affect orgasms?
It can actually radically affect orgasms. And one of the things that's been underappreciated with all the excitement around medical applications for cannabis is a lot of the pop cultural use around cannabis is about enhancing sexual experiences. And we're just now starting to understand exactly how it works. But the reason cannabis is such a powerful medicine is because we have this system inside our bodies called an endocannabinoid system. And it's a communication system within our body that uses chemicals that are almost identical to the chemicals found in the cannabis plant. And we're just now starting to fully understand what it is that the endocannabinoid system does. But one of the things that it does is control the pleasure and reward system associated with sexual experiences. So literally some of the feel-good chemicals that you get from an orgasm are virtually chemically identical to the chemicals found in the cannabis plant. And that's the chemical explanation on why it is that this plant can be so powerful in a sexual context.
Is there something that really surprised you in all of your cannabis research?
I guess a big part of it is the fact that it doesn't have to be psychoactive. Like a lot of the time, people that aren't familiar with cannabis, they associate it with being like really high and out of it, and they often experiences that they didn't find pleasurable. Whereas so many of the chemicals that can have this profound impacts in the sexual context don't even get you high at all. And I think that's something that I think really needs to be driven home to people, that cannabis doesn't mean getting high necessarily.
I know you've talked quite a bit about how music affects sexual function and how it affects your overall vibe when you're on psychedelics. What role does music really play during cannabis use?
It's fascinating. The history of how we started this whole war on cannabis came out of the jazz scene, and it was rooted in some very racist ideas that these African American jazz musicians were getting white women high and having sex with them. That if you listen to the historical arguments on why we needed to ban cannabis, it was all about that. And what's fascinating about it is obviously the mean-spirited racist take on it. It was awful in all kinds of ways. But the observation that there's a sexual component to music and cannabis turned out to be right on the nose. And if you think about almost any music genre, the artists are very often associated with cannabis use. And if you go to almost any concert, the audience is very often partaking in cannabis. And the reason for that is that the cannabis affects the rhythmic entrainment process. It literally makes the experience of music more pleasurable. And sexuality is also a rhythmic entrainment process. That discovery that I was describing about how epilepsy and sexuality actually have a lot in common, it's that the common element in them is it's about rhythmic stimulation. And with epilepsy, it goes to a very bad place. And, a strobe light or the wrong series of rhythmic stimuli can cause a seizure. But with sexual stimulation, almost every aspect of sexual stimulation, whether it's visual or audio or physical, are all rhythmic in nature. And because cannabis is able to enhance that experience of rhythmic entrainment, it's able to intensify the experience of sexual trance.
Well, thank you for all that information. Before we go, are there any other teases from your book that you'd like to share?
I would actually. When we explore cannabis in a sexual context, one of the challenges around it is it's often viewed in a negative light by the broader society. And what we've tried to do in the book is outline a theory of human evolution that looks at where did this actually start. And if we think about what early humans did in the early human mating rituals that almost certainly evolved in a time when we were coexisting with these plants, it suggests a very different way of understanding sexuality. And the fact that cannabis enhances people's sexual experiences may very well be an adaptive trait that we've evolved to benefit from.
Thank you so much. We'll be right back with more Sex Talk.
Still ahead on Sex Talk. AI sex toys, vaginal dryness treatments, STI numbers going up, the science of morning arousal. Do sex supplements really work?
Back here on Sex Talk, let's take some more questions from our viewers.
Excellent. Dr. Leah, this next question is pretty much in the news now lately, and it's kind of permeated all industries, but I never thought it would get into our bedrooms, okay? A viewer wants to know, what are AI, artificial intelligence sex toys, and do they work?
Well, AI can be used to help determine different settings or techniques that a sex toy uses. Or, with additional feedback from technology, it can be used to help visualize physiological arousal and orgasm. It can help make experiences more pleasurable for people. It could also tailor the experiences to an individual's preferences or open up new ways of exploring one's sexuality that simply did not exist before.
Yeah, you said feedback. Can you expand on that a little bit for us, please?
Well, there is an AI sex toy called the Lioness that looks like a typical dual stimulator. Its technology is equivalent to an early smartphone, and it's equipped with a suite of sensors to visualize your own unique arousal and orgasm. You can see your session after the fact or in real time using the live view feature, and there is an AI-driven hotspot algorithm to help visualize peak moments of arousal and orgasm. It's a great tool for learning more about your body and trying new things to see how it affects your pleasure or your partner's pleasure.
Okay, let me try to get this straight. So I can look back at this feedback to see what made my partner reach orgasm. I'm going to repeat this the next time. You can have it mapped out, maybe have little notes on the post-it notes on the side of the bed. But what is it? Is it something somebody wears, or is it Bluetooth enabled?
Yeah, a lot of times they're linked to a smartphone. Yep, absolutely.
Okay.
So, it would make me a little nervous on it's being recorded out there. I don't know behind the privacy aspect of that. I'm sure they have it down. I don't know what security settings they have on these. So that would make me a little nervous, but I'm sure they have it covered.
Yeah, I'm sure. Okay, anyway, what are the other types of high-tech sex toys are out there?
Well, there are sex toys that can be operated with a remote control, and then there's virtual reality or VR sex toys. These connect and sync to VR pornography content so that you can be fully immersed in this fantasy instead of watching it on a 2D screen.
Wow, very nice. Okay. A woman wants to know, what's the best hormonal treatment for vaginal dryness?
The most common treatment for vaginal dryness due to low estrogen levels is topical estrogen therapy, which will replace some of the hormones and will relieve the symptoms. But it doesn't put as much estrogen in your bloodstream as the hormone therapy that you would take in pill form.
Okay, are there different types of estrogen?
Yeah, most women use one of 3 types of vaginal estrogen. The first one I would like to talk to you about is a ring. Your doctor inserts it into your vagina where it releases a steady stream of estrogen directly to the tissues. The ring is soft and flexible, but you have to replace it every 3 months. You can also use a tablet that you place on a disposable applicator and insert it into your vagina. And finally, there's a cream. Again, you insert the medicine with an applicator daily for 1 to 2 weeks, and then the dose slowly decreases.
So what causes vaginal dryness, Dr. Leah?
Well, first, menopause, and then almost 1 out of 3 women deals with vaginal dryness going through this change. This happens due to the drop in estrogen levels, which reduces the amount of moisture available. Estrogen levels can also drop because of childbirth and breastfeeding, or radiation and chemotherapy treatment for cancer, or having an ovary surgically removed, or using an anti-estrogen medication used to treat uterine fibroids and also endometriosis.
Are there any side effects to this?
Any estrogen product can have some side effects, such as vaginal bleeding and breast pain. Topical estrogen may not be recommended when you've got breast cancer, have a history of endometrial cancer, have vaginal bleeding, but don't know why, or if you're pregnant or breastfeeding. There isn't much research on the long-term use of estrogen, but doctors do believe it's safe.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about sex talk. Go to AskDrLeah.com.
There are several STDs on the rise. Of course, anyone who's had sex is at risk, but some populations have a higher risk. We have the latest from the Centers for Disease Control and Prevention.
Sexually transmitted diseases, or STDs, continue to be a public health concern, affecting individuals of all ages, backgrounds, and sexual orientations. In recent years, the prevalence of STDs has been on the rise in the United States. Chlamydia remains the most commonly reported STD, with more than 1.8 million cases reported in 2019. Other STDs are on the rise, like gonorrhea and even syphilis, which was once almost eliminated. There are several factors contributing to these rising rates, like healthcare access, stigma, and even drug resistance. The key to prevention is becoming informed, having safe sex, and getting tested and treated. Even though STDs are on the rise, there are more tests and treatments available today.
One of the best ways to prevent STDs is to prepare before you're in the heat of the moment. As the CDC says, prepare before you're there. Get tested, know your risk, and talk to your partner. Now let's take on some more questions.
That's a good prepare. I like that. Okay. A viewer wants to know, is there a safe way to do oral sex while wearing braces?
Well, braces and sex are a topic that many adults think about before starting orthodontic treatment, but they rarely discuss it. It will always depend on the person and their sexual partner. Wearing braces can be awkward, and you might need a little period of adaptation to be able to kiss someone or perform oral sex normally. But it is possible that that other person is the one that might be a little more uncomfortable for fear of cutting or noticing something on the tongue or penis. For this, trust in the couple and being able to talk about everything is fundamental. It's just getting practice, really, that's all.
So I'm sure there's a lot of concern about perhaps cuts or scrapes in the mouth or genital areas. Is that a valid concern to have while wearing braces?
Yeah, so if you wear braces, make sure to be careful when performing oral sex with your partner. Do it gently and carefully.
Our next question. A man says, I used to always get morning erections, but when I turned 35, they stop. Is something wrong with me?
Well, if you get nocturnal erections, which are erections that happen when you're asleep, there's a good chance that you'll wake up from time to time with an erection. Most guys notice their erections when they wake up in the morning, but it's actually common to get several erections during the night, often for a variety of reasons. Just like morning erections are normal, it's also perfectly normal to sometimes wake up without an erection. However, if you often wake up without an erection, or if you notice a sudden drop in nighttime or morning erections, it could be a sign of an underlying health issue that may be causing erectile dysfunction.
So what are some of those health issues?
Well, ED has a range of potential causes. Common physical health issues that cause or contribute to ED are things like clogged arteries, high blood pressure, and diabetes. Some prescription drugs, such as anti-androgens, antidepressants, blood pressure medications, tranquilizers, ulcer medications, and appetite suppressants, may also contribute to ED and stop you from getting nighttime erections. Erectile dysfunction can also develop as a result of psychological issues such as anxiety about sex or depression, chronic stress, and low self-esteem.
What should a guy do if he has no morning erection, Dr. Leah?
Well, erectile dysfunction is almost always treatable. If you wake up without a morning erection regularly and you're having trouble with waking erections as well, it's a good idea to talk to your healthcare professional for solutions, including medication. Most of the time, medications like Viagra, Cialis, and Stendra can restore your sexual function and make it easier for you to get an erection before and during sex.
There you go. Our last question of the day. A viewer wants to know, do libido vitamins work?
If you're experiencing a sluggish libido, difficulty getting an erection or orgasming, or any other sexual dysfunction, you may be tempted to try a natural approach. After all, some herbal remedies have been used for thousands of years. But before you start taking any supplements that promise to rev up your sex drive, you should know their limitations and potential risks.
Yeah, that's good advice, because even if you go into a gas station, you're going to go inside and buy some peanuts or something. Right there on the counter, there's a ton of vitamins, male enhancement, testosterone, this and that and the other. There's always pictures of women in ecstasy. So there's no magic pill. Am I correct?
Yeah, you're absolutely right. If there were a magic pill and somebody created it, they'd be a billionaire by now, right? There is no magic pill that will make your sex life just amazing. Supplements or herbs won't provide this instant arousal, orgasms, or erections. Still, there are supplements that support underlying health when taken over time that can improve your sex life, the same way that exercise or a healthy diet can do.
If you have to recommend one of the ones you're talking about to boost the sex drive, what would it be?
Well, if you have any deficiencies, the first thing that you would want to look at would be what your deficiencies are. So if you're zinc deficient or vitamin D deficient, if you're deficient in those things, then you would need to supplement them. However, if you are not deficient, supplementing too much of those is not going to help. It's not like, oh, if a little is good, more is better. It does not work that way. And keep in mind, the U.S. Food and Drug Administration does not regulate herbs, vitamins, and supplements the way it regulates pharmaceuticals. This means you can't believe whatever product promises, since those claims don't have to be proven the same way a medication does in clinical trials. So if you're experiencing sexual dysfunction such as low libido, it's best to speak with a physician or a sex therapist. But if I had to recommend one natural way to boost your sex drive, sorry, but it is not a pill, it is Exercise. People always want this magic pill, and I use this example all the time. There was a research study that showed that walking 10 minutes a day improved mood and really helped with depression. However, people still wanted a pill. So I said, pretend the pill is a 5-minute walk away. Walk the 5 minutes, take the pill, and come back, and you'll feel better. Think of it that way. But people always want a pill rather than just putting in the hard work.
All right, I'm gonna go for a walk. I'll be right back, okay?
Perfect. Put you in a better mood there. Well, Derek, that is all the time we have for today, but you can still send in your questions. I'm Dr. Leah Janine, and we will see you next time when we answer the questions you've always wanted to ask on Sex Talk.